Good afternoon. Welcome to the Monday, June 4th Health and Human Services Committee meeting. Can you rise? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'm 3 o'clock. We're rocking.
Yeah, you're not supposed to, Mike's not here, so until he's, I mean, I don't know where he is, but it won't, the votes won't happen without him, so you'll have.
All right.
to vote until Chad's back up.
Number 3, adoption of agenda. Apparently, our high-tech solution to no problems is not working. So, adoption of the agenda. Do we have a motion and support? We have a motion by Romano, support by Drolet. All in favor? Aye. All opposed? The agenda is adopted. Number 4, approval of minutes. Dated May 7th, 2018. Motion to approve. We have a motion by Brown, support by Leonetti. All in favor, please vote. Apparently we have joined the 21st century again. Thank you. The vote is 10-0. Number 5, public participation. Anyone in the audience wishing to speak? Going once, going twice, going thrice, seeing and hearing none. Public participation is now officially closed. Number 6, department recommendations. Budget amendment, Macomb Community Action, Office of Senior Services. Who's doing this? Gary isn't here yet. We'll move it to, well, hopefully he'll make it by the time we get to 7A. 6B, budget amendment, Health Department, Children's Special Health Care Services, grant positions, 1 program manager and 1 public health nurse, 2. Krista Willett, Deputy Health Officer.
Good afternoon.
Good afternoon. You want to tell us what you're doing?
Yes, we're requesting a motion to approve a fiscal year 2018 budget amendment to increase the state grant revenue for the Children's Special Health Care Services program. And with this additional funds, we will like to hire a program manager and a public health nurse for the program. No county general funds will be needed to support these 2 positions.
All right, before we begin, is there a motion and support? We have a motion by Stoddard, we have support by Lucido for discussion. Let me see if this comes.
Blue button.
Okay, Commissioner Carabelli.
Thank you, Mr. Chairman. It was my understanding, and if I could be wrong, that we were holding off to filling any positions till after the first of the year. We were going to get the presentation on the compensation and job classification study. And with that, it's not for us to make the determination. That's the HR and executive's office. But that information for them to sign off on these positions to us with that study is saying, yes, this falls within this classification, it's this type of position, this grade, and yes, please fulfill this. Funds are here, Steve will verify that, and then they gave their blessing, and then we would approve these positions. So without that blessing from HR, basically saying, yes, here is the this position, it's classified either a union, non-union, whatever it may be, and then we would have that information to say, yes, let's go ahead and do it. So I personally am in a position that I have no problem filling these positions, but I need that okay from HR and the whole process prior to okaying it. That's just me. Thank you, Mr. Chair.
Thank you. Steve, do you want to comment on this?
Yeah, particularly with this position, I'm not aware of a change in the classification
No, these are.
in terms of the public health nurse classifications. I'd have to verify that, but I'm not aware of any change in that particular classification as a result of the classification study, or the compensation study, if you want to say that.
I'm not either.
If I, Mr. Chairman,
Commissioner Carabelli.
and if that so is the case, I guess for my benefit, I would like to see a letter from HR saying, yes, this is not affected in the classification and wage study. You know what I'm saying?
Is
Just
that
saying,
something you'd want before full board?
yes, I have no problem moving this to full board, but I'm gonna need verification that they're signing off saying, yes, 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 if that's fair.
Well, seeing and hearing that, if anything, this has got to get forwarded to finance originally, and then after finance to full board. And being that this is a budget amendment that is basically a grant, and so on and so forth, I think we might be able to get something like that out of HR. Steve, could you
Yeah,
look into?
Yeah, I'll dog that.
Okay, I'd say if we can recommend it today, approve it, and then wait until it comes in at finance and/or full board, and then deal with it at that point of time. Unless somebody's got a problem with that. Thank you. Next, we've got Chairman Smith.
Thank you.
Well-
Steve and I just spoke a little while ago kind of about this, that one of the reasons, and probably, I mean, at least one of my main reasons for not approving any of the positions before was that we were waiting to see if any of the classifications were going to be changed. I mean, maybe the public health nurse, one or two might be moved. They might all have been eradicated in that and moved to a 3, and maybe that position might go from $30,000 to $45,000, or the recommendation for it, right? So those were kind of the things that I think, at least I was concerned about when, before we put a position. So if you could do that, I was gonna suggest the same thing. I don't have any problem moving it forward, but asking that we get verification that nothing in the classification study or compensation study has drastically changed these positions. And we realize it's coming from grant funding, so it's not anything to do with the general fund, but we want to keep consistent on what we've been doing. So I'm, again, for that, but I'm going to be asking the same thing for all of these positions.
Yeah, there's a
Right.
whole bunch of them coming.
Right, so we can
This
maybe
week and
kill that
next, so-
conversation and just everything we move forward, just based on the fact that we're going to get that letter from them, based on what we discussed, right? Sound good?
Yeah, so it applies to the next item on the agenda.
Yes, yes, it does. All right, thank you.
All right, thank you. Seeing no more comments or questions, we have a motion and support to move forward this to finance. Can you please vote? We have the motion passes 11-0. This will be forwarded to finance. Number C, you're not going anywhere, are you?
Nope.
Budget amendment, Health Department funding for position 1, public health nurse. 2, please address the situation.
So this was a position that we had put in for this year's budget,
Yeah.
and we're requesting to fill that now.
All right, can I get a motion to approve and support for discussion purposes? Okay. Do we have support? Thank you very much. Comments, questions, or discussion? Commissioner Toko?
Thank you. What's changed that we need this position?
Dr. Lokar is here to address the additional needs for the communicable disease program.
We originally requested this position to help with the investigation of hepatitis cases, and we've had a. Yep. We originally requested this position to help with the investigation of hepatitis cases, and that has been a direct result of the opioid epidemic problem in the county. So we've had dramatic increase in both hepatitis C, and we've just been going through a 2-year increase in hepatitis A cases.
Position would be just for that project, or?
Well, primarily. I mean, we always use staff the best we can. If there's another thing going on, we will rotate staff. But yes, it's primarily to deal with these cases of hepatitis.
Do you have any data, or do you keep any, I mean, so if we're adding positions, I'd like to, be able to have be able to rely on something to show that there's a need.
Yeah. Well, since 2014, we've been getting, typically on average, there's 600 to 800 cases of hepatitis C that are chronic cases that are reported to us. In 2014, we had 15 cases of hepatitis C. In 2017, we had 49. And then our hepatitis A outbreak, we had 9 cases in 2016, 201 cases in 2017, and 27 so far this year. So there's been a dramatic increase in the number of cases that we've had to address.
So what would this nurse's function be then?
They do case investigation and contact tracing. So cases are reported to us from healthcare providers or hospitals. Nurses contact the provider to get information. They also talk to the case themselves, find out who their contacts are, and then we'll do contact tracing. So we'll contact people who may have been exposed, make recommendations for treatment or post-exposure treatment.
Okay. Okay, thank you.
Thank you very much. Next on the list is Commissioner Lucido.
Yeah, I believe it is, yes.
The nursing union. The nursing union, MNA. Thank you.
Thank you very much. Commissioner Brown.
Thank you, Mr. Chairman. Do you know the correlation of why these 2 hepatitis strains are showing up so prevalent in Macomb County? Why the outbreak? I know we've heard about it previously, but do you have any knowledge of what's precipitating this sudden rise?
Well, hepatitis C is a bloodborne pathogen that's transmitted through the sharing of exposure to blood. So injection drug use, there's a risk there. Hepatitis A, half of the cases have reported substance abuse of some kind. Although hepatitis A is not thought of as a bloodborne pathogen, there is transmission in settings where people use because hygienic practices diminish. Hepatitis A is a fecal transmission, but in the setting of drug use, hygiene diminishes and there's a risk of transmission. So half of the hepatitis A cases, more than 100, have reported, self-reported substance misuse.
Now, is that because drug use has gone up so much in this county? We've always had drugs in this county. We've always had drug issues. Is this because drug use is what's...
Well,
maybe you're not in a position, maybe that's not your area, but what's the...
Sometimes a virus is introduced into a population that may be able to transmit it very efficiently. And that's what's happened, I think, with hepatitis A for sure, is that somehow, somebody with hepatitis A was using and it started spreading and the environment was right and it just took off. And that's how you get these outbreaks. This will pass with time, but we're kind of in the midst of it right now.
Where are the clusters at? Where are the clusters located?
In the county?
Yes.
Most of the cases are in the southern part of the county.
Okay.
That's where their residence is.
Okay. Thank you. Thank you, Doctor. Appreciate it.
Thank you, Commissioner. Next we have Commissioner Leonetti.
Thank you, Mr. Chair. I do note, looking at the budget, that the executive, this is one of the 16 positions that the executive proposed. However, in looking at it, I know it's a small difference, but the proposal was for a salary and benefits to include $80,796. And here it looks like the total amount would be $83,397. Is there a reason for that difference?
Yes, there is, actually. You'll see that in a number of the other ones. And I don't know about every single one off the top of my head, but With the new folks that go into the DC plan, they get 6% of their salary plus $2,600 a year.
Okay.
So with the difference that you're talking about is the $2,600.
Okay.
And you'll see that probably if you compare other positions on current proposals with the old
Okay. Okay.
list from last year.
All right, thanks, Steve. I appreciate that. One other question I have too. I know we're at the height of it, the hepatitis thing. What happens after it wanes, if it ever wanes? I mean, what's this position going to do then? I mean, obviously it's a flexible, address other issues at the time. I mean, it's not just.
Communicable disease is one of those things that we are responsible for all the time. And sometimes there's no way to predict. I mean, a phone call will come in and something will start, and then we've got to deal with it. So having the staff to be able to respond quickly when these happen is very beneficial to us. If it's not this, it will be something else.
Understandable. Okay, thank you. Thank you, Mr. Chair.
Thank you. Next, Commissioner Drollet.
Thank you, Mr. Chair, and thanks for answering some questions. Just to follow up on some of the other commissioners' questions, you mentioned that this is sort of spiking here in Macomb County the last few years, and that it would likely, hopefully, run its course, quicker the better. But it has on other diseases also kind of hit and then spiked and then declined. Couldn't we just reallocate resources as we face new challenges? I mean, our population hasn't really grown that much. So are we just getting more disease than we've ever been? Why couldn't we reallocate from other ones that have waned?
Well, I guess, yes, in some ways we could try to do that. I think right now we're just short of staff and have a hard time dealing with this. Yes, the numbers may fall in this, but then they may go up in something else. It's hard to predict. I mean, there's no way to know. We didn't see this one coming. For example.
Has staffing for this particular department increased substantially compared to the population rate in Macomb County? Or is that because we've always been understaffed, if that's the case? Or
Not the communicable disease program, no. That has been fairly steady over the years. And there may have been some reduction in 2008 when we had the reduction of county budget at that time.
okay. Thank you very much. Thank you, Mr. Chair.
Thank you. Hopefully you can talk into the microphone and further. Next, we have Commissioner Carabelli.
Thank you, Mr. Chairman. If you can repeat the last part you just said to Commissioner Drollet, you said if it goes down, you reduce the budget later on?
No, in 2008, when there were budget cuts, we did cut positions. And so as this problem has emerged now, we're asking to replace, if we can, some of these positions. So the communicable disease program has not grown over time in terms of numbers. We've had pretty much the same small number of staff doing a lot of work.
Okay, and I don't recall, so bear with me. So in 2008, how many nurses did you have?
I don't have the exact figures with me.
Okay. When the information comes to us for finance, if you can provide us because you stated in 2008 there were cuts in this department, I'd like to see where the numbers were,
Okay.
and then where you're at today and where you're asking to have. So your org chart for that department from 8 to prior to this position and then with this position.
Okay.
And on that note, just like I said prior to this, until we get something from HR saying yes, Steve, we've always used to see the pay range, if it was between the X and Y, where is this falling into that pay range? I mean, there's a lot of things that need to be included with this. And then the question, you gave numbers on the first, I think it was Hep A, you said it was 2014, you gave us stats from to present, and then on the C, you gave us stats from 2016 to present. So I'm guessing 14 and 15 were nothing or nothing to talk about.
No.
So when you give us stats, I'd like to see true stats. So if you're going to go from 14 from 1, you do 14. I'd like to see it across the board. And then my question for you, I'm not here to micromanage, my question is that if you've looked at this and there's a spike in a certain area, have you looked at contracting out for that particular thing so that over a period of time you're not laying somebody off afterwards? Or just like the grant dollars, we hire a position for the grant dollars and the grant runs out, then we take it out of the general fund to pay for these positions because we lean on them. So I'm looking at a bigger picture here, and I want to make sure you exhausted all the tools that you have.
We did have a grant-funded nurse that was doing hepatitis C investigation, and the grant ran out at the end of 2017, so that position was lost.
Well, that's information I
And
think the
that's-
rest of us would like to know,
Yeah.
that that position was there.
Yeah.
It's gone because the grant ran out, now it's out of the general. Do you see what I'm saying? I'm picking,
Hmm.
and we're having this conversation to get as much information so we can make a formulated decision. So I think it's imperative that you come with a business case, that you're talking to the residents saying this is why we need it. And the best information you can provide to us would be great, so that we can say, okay, HR signed off, the executive signed off, Steve signed off, we're good to go. So we need all that information. Thank you, Mr. Chair.
Thank you. Next up is Chairman Smith.
Thank you. Steve, I just had a question as to what Rob was talking about, the additional 2,600. When these positions were originally put in the budget, though, we had already gone to the DC plan, right? I mean, wasn't this anticipated? I mean, you said you added 2,600.
Right, when we calculated the cost of the position, we left out the 2,600 inadvertently.
All right, that's what I just
Right,
didn't
yeah,
understand.
no, the DC plan, yeah, has been in effect. When we costed this out, we missed it.
Okay, that's fine. I got it. And secondarily, I would agree with Commissioner Carabelli. This is always a sales slash informational. The more information you give us, like that last little bit of information kind of is a big deal, right? We had this position, it was grant funded, and it got cut from us, right? So that makes a big difference into, I just want an extra position, or I had one, we lost it. Now we're kind of, swimming upstream right now. So those type of things, if anything you can think of that helps your case, please present them to us. Thank you.
Thank you. Last on the list is Commissioner Drollet.
Thank you for recognizing me for a second time. And just to follow up on Commissioner Carabelli's question, I also would like to see the number of positions funded over at least going back to 2008, and that would give us an idea moving forward. But also, to his question, if this is something that we hope runs its course, and the quicker the better, is it possible to contract it out for a 2 or 3 year period, and that way we don't end up having to lay off a union position, or when hopefully this ends up running its course or being dealt with?
You want me to answer that, or, I mean, so I think we could contract a position out. We sometimes get into union issues when we do that, so we have to be careful.
So yes, it could be, but we just have to make sure that we
would have to
don't have a
move.
conflict there.
Yeah, we'd have to use county funds to hire out a contractual
So
position.
that hasn't been looked in specific to this position at this point, has not been,
It was when it was grant funded.
when it was grant funded. Okay, Steve, you look like you want to say something.
So keep in mind, much as Gary is going to address his issue, the nature of the job could determine whether we can contract it or non-contract or not contract it in accordance with the IRS rules.
Right, but
Depending on the
obviously it
direction-
worked when we had grant funding.
Pardon?
Obviously, it must have worked when we had grant funding. Right, so
So, just, it's a fine line, and once,
so can it work?
you gotta go through the questionnaire about how much of that person's work is directed and determined, how independently they work or not independently. Do they
Okay,
use our equipment? Do we provide them a workplace? Do we
right.
set their hours? Do we
Do you th-
evaluate their work?
Did it work when it was grant funded?
Yes.
Okay. And so we didn't have a conflict with the IRS or anything along those lines? No.
Yeah, whether we went through that determination, I don't know, but
Okay,
positions around the county that, we do evaluate. Gary's got a set of them, for example.
gotcha. Okay, but we know it can work at least for a grant funded position, so it's conceivable
Well,
that it
maybe
could
for
also
this
work.
grant-funded position, I just want to be clear.
Yeah, for that particular grant funded
Right.
position, so that,
Each position
that
needs-
position can be contracted, it was when it was grant funded. It's just a question of if we fund it ourselves rather than grant funding and gave the same, mission and so forth in the same type of work environment, it seems like it should be able to work as well if the same parameters were
I mean,
before.
I don't know the history of it, so I don't want to, can't really speak to authoritatively right now.
Yeah.
Knowing the nature of the work then, whether we evaluated it then, or, employee versus contract, I'm just making you aware that
Okay, okay, thank
we
you.
may or may not be able to do that.
I'll take it as we can.
Possibly. There are no more speakers or questions. I'm actually a little surprised at the amount of discussion we've had in the last year, maybe a little more, about the problems with the IRS and the 1099 positions and so on and so forth. I don't remember this being a bone of contention previously, but it seems like lately it has become a problem, if you will. Whether or not how that works in grant funding versus general fund, I'm looking forward to being able to discuss it possibly with you, Steve, to find out why it's easier to do it on a grant than it is on general fund.
The funding source has nothing to do with it, it's the nature of the work.
Okay. All right. We have a motion and support. Please vote. The machines are working all of a sudden. Passed 10-1. Being that, I see Mr. Cutler has decided to join us. Gary, budget amendment, Macomb Community Action, Office of Senior Services. The one, the only. Supervisor Gary Cutler. Hello, Gary.
Thank you. I apologize for being late.
It's all right. Just this once. What are you doing and why do you want to do it?
I don't know what I'm doing. Since we brought this to the board back originally in December, we have worked internally on our structure and reporting and the job duties, et cetera. So we've tried to address most of the IRS issues internally and how we're handling these contracted employees.
Okay. Were you here when Commissioner Carabelli was bringing up the letter and the correspondence that we needed from HR?
I was.
Okay. So you understand a part of this going forward, as long as you're aware of it.
The position, I can assure you that the position that we're discussing here was not part of the comp study, because the position we're talking about here was the resource advocate, and there were no people in those positions during the time of the class and comp study, so this position was not studied at all.
All right. We'll get you in on this. Prior to any further discussion, can I get a motion to approve for discussion? Commissioner Lucido, do I have support by Commissioner Sauger? Commissioner Leonetti? Yes, you are, sir.
Okay.
Never give up on our opportunity.
Gotcha. Thank you, Mr. Chair. Good to see you, Gary. So, I know you were here a couple months ago with this, and I did have a chance to talk to council about it, and they verified that the IRS would probably like it if we move this to a regular employed position. The question I have, looking at the board recommendation, I may be a little bit confused. The contract services, the amount that you have that you want to adjust to is $240,000. Is that correct?
That was the amount at the time. Again, those dollar amounts would change because of we're further through the year. So roughly half of that is what we need this current year.
Okay. So, and again, you have to forgive us because this is what we don't have access to all the line items underneath your contract services. And so I'm a little bit, and I looked at this morning. I do apologize. Usually I try to do my homework a day or so before. How much are these positions going to be? How many positions are there, and what are they going to be paid then? Looking at this thing, all I see is contract services, $240,000. No effect on the budget because it's going to go out of contracts into wages. But how many positions are we talking about here, and how much are they paid? Yeah.
So, it's a wonderful question, and again, it's a very gray area even to myself, because currently they are being paid on a per unit basis.
Okay.
So if they do a application, there are dollar amounts assigned for each of these different applications and different items that they do.
Okay.
We are paying them, the standard unit is being paid $34. There are some units that are being paid $50, and just this morning I met with our executive director because like Michigan Bridges, they've changed their application form, so we're going to have to, if they remain as a contracted person, we're going to want to change that rate downwards because it looks to me like that form should take substantially less time than the previous form took. But currently they're being paid on a per unit basis, and having done grant accounting for a number of years, normally units are either a full hour or like a quarter hour. Well, I'm assuming that we're not paying somebody $150 an hour to do this work, so I'm assuming that the unit is an hour, and that would include all the travel time. When they're contractors, we don't pay them mileage, et cetera. So it'd be getting from their home, being that they're contractors, that's their base location, to the in-home person that they're visiting, doing the application and going on to the next place of business. And we were looking at, we're looking at a part-time position similar to our, what's called a field worker in our budget. Again, there was some discussion internally about the people doing case management would be a little bit different than, so internally they were looking at a couple different positions. We're looking for this to be cost neutral with a possible savings in the overall cost of things. Again, the design wasn't really to be the cost savings. The design of this was to not run afoul of the IRS because of the actions and how the people were doing specific things were employee-like. So we've moved in the direction of having employees doing some of this work currently, so that we're, again, not knowing where we're going to end up on this, we wanted to make sure that we didn't run afoul of the IRS. So we've been working since it came to you, we've been working over a period of time having employees take on some of these duties.
Okay, so there's a ton of questions I guess I could ask based on your explanation. So, again, the question I had is, how many people are we talking about here? How many positions are we talking about?
There are currently 8 part-time people
Okay.
or 8 contractors in this position.
Okay, so these 8 contractors would then conceivably become part-time employees of Macomb County.
Assuming that they accepted the positions at the pay rate, because it would be less than what they're currently
Okay.
making, because they're now contractors. They have to pay their own FICA and their own other items. So again, if they all transferred over, that would be the most we would have.
And you conceivably think, I know I'm not going to put you on the spot to this, you think that this overall, we're doing it primarily to satisfy IRS concerns, but you conceivably think that this could even end up being a savings, possibly? I mean, I don't want to put you on the spot. Right.
I will tell you that based on our budget and the amount of money we have and the budget constraints in building our next year's budget, that I'm looking for it to be a savings. My managers should be able to schedule appointments in a manner in which the units should be able to be done on a better timing basis than a contractor can. Again, that's why we have managers and people looking at these things. We should be able to do a better job of scheduling, et cetera, and get, again, it's hard to say with a contractor getting paid on a unit basis if, again, we're looking at applications and production things. I think it'll be much more transparent with them working as an employee as opposed to a contractor.
Okay, I get that. All right, I have no further questions at this time. Good to see you, Gary. Thank you, Mr. Chair.
Thank you. We have Commissioner Carabelli.
Thank you, Mr. Chair. And Gary, I appreciate you addressing the questions that I had posed earlier in requests, but yours should be a lot easier than if you're saying that it's not part of the study or any of that. we would still like to see something from HR saying that this isn't included in the study and compensation,
Yep.
and that they sign off at it as well. So yours should be a lot
Yep.
easier than everybody
No,
else's.
but again,
without any objection.
that's certainly not a problem.
Thank you, Mr. Chair.
Thank you. Gary, one question. It says that money is coming out of, are you getting any money out of AAA 1B?
Okay, yes, I get money from AAA 1B for 6 programs they give us money for. And these people actually do work in all 6 of these programs. Again, so resource advocacy is one of the programs AAA 1B pays us for. These people are resource advocates. But when they do an application that's for our home injury control program, they get charged to home injury, their time gets charged to home injury control. So, and that's the AAA program. If they're doing an application for Meals on Wheels, their time gets, their, not really time, their unit. So if you're an applicant, and I go to your house and I'm the resource advocate, the contractor, and I sign you up for Meals on Wheels, that application fee, that $34 would get charged to Meals on Wheels, which is a AAA funded, partially. It's the board helps fund that also through general fund allocation. AAA helps fund that, but and also the resource advocacy is also funded. Again, Macomb Community Action with funds that comes through the board. There's commingled funds in there, so it's not fully funded by AAA 1B. It's funded
Okay.
across. And
But
it's funded
that,
across many agencies programs.
each one of these employees has a ability of wearing different hats during the same day, by the sound of it.
They do applications based on the list they have, and the list will include people that need wheelchair ramps in the home injury controls, lawn service in our chore program,
Right.
Meals on Wheels, or just like this Michigan Bridges application to be part of DHHS. So they do all sorts of different programs, and then we bill to the programs that get the benefit from them.
All right. That's what I thought. Thank you, Gary. Any other comments or questions? We have a motion and support. Let's see if we can vote this time again. Machine. At the beginning, we did. Okay, no problem. Did it pass? It passed 11 zip. Thank you very much, Gary. Number 7, correspondence, newsletter, what every veteran should know. This is a receive and file. We have a motion by Grolette, support by Carabelli. Any comments or questions? Can we please vote? Thank you very much. Passed 11-0. Number 8, new business. Anybody have new business from commissioners? Commissioner Carabelli.
Thank you, Mr. Chairman. Just a real brief update of the policy conference, Detroit Regional Chamber. Biggest topic that was going on was the RTA. And the board chair had the opportunity to meet the gentleman who ran the RTA for the very first time. And I believe he's going to want to come in and talk to the Board of Commissioners. A lot of discussion up there. I learned a lot, and I'm sure Bob did as well, on where different stances are throughout the counties and through certain cities. There was discussion up there also on road funding, transportation, back to the RTA of what type of transportation for the RTA, the mayor's position, the Wayne County Executive's position, Washtenaws' position, and then Oakland and Macomb's position. With that, there's still a lot of talk to be had. The smart bus was not being dragged into the mud. It was saying, let that go as a total separate item. They didn't want to commingle the two items. They wanted to make it clear that this was not commingling one or the other. And as of right now, it doesn't look like, from my observation, that this is going to go onto the ballot for this year. from what I gathered from talking to some of the individuals in Mackinac. There's also one other note for the commissioners that have been here for a while. There used to be a summit, and Macomb County took the lead a few years back, and we did it on rapid transportation. And it was a great summit. Great things were going to be coming out of there. Then all of a sudden, all the counties got kind of pushed to the side. There were other counties in SEMCOG that want to participate in the summit again. Wayne County was supposed to host the last one, and it kind of didn't happen. They had some issues going on down in Wayne County. So talking to some of the other counties, we talked about getting back together and starting the summit, maybe even reinstituting the transportation summit if it's amenable to all. So talking to the other county commissioners and county leaders, it was quite fruitful to hear that they do want to get back together, other than it got dropped. So that's something that's on the horizon that we're going to be working on. There's a lot more. I can put a little letter together and pass it on to the rest of the commissioners, but it was a lot of good information that we received up there.
Commissioner Drollet.
Thank you, Mr. Chair. Just through you to Commissioner Carabelli, thank you for the update. I appreciate it. Just something, just listening to the media, the radio, the newspapers, it sounded like the focus of much of the discussion was on the RTA. And I'm glad that you noted that there was some discussion about roads, but what percentage of discussion was about roads compared to the RTA?
If I had to take a guess, not scientifically, it would probably be 75% discussion on RTA and 25% discussion on roads, just throwing a number out, and everything else.
Okay, that makes sense, because the number one thing I hear from my constituents is all about the RTA. They don't care about the roads. They're in great shape, so thank you.
All right. Commissioner Brown.
Thank you, Commissioner Cabelli, on the information. It is the Detroit Regional Policy Conference, so it was expected they'd be talking about the Regional Transportation Authority, right? That's their RTA, yeah. But I would just say, I wouldn't waste their time sending anybody out here to talk about the RTA. It's dead as a doornav out here, and it'd just be a waste of their time, and I don't want to give them, quite frankly, the forum to talk about it. My personal opinion. Thank you.
Thank you. Commissioner Smith.
Thanks. Jim, that's a great job on that, and we are going to put together a little newsletter on everything that we talked about, the people that we met with. We had a lot of good conversations with St. Clair, Wayne, and Oakland County commissioners, which is always a good thing about getting up there. I would say that the RTA is probably, it sounds dead for this time, but it does sound like there might have been a little more movement on some discussions that might make it a little more reasonable and appetizing at some point, to some anyway. So it did sound, for all intents and purposes, like they were not going to be able to make that ballot this time. There was a lot of discussion on how the commissioners and all the districts were kind of left out of all the discussions on what really matters to a lot of the people that would be voting on this. But Jim is right. There was a lot of great talk about SMART and how they've stepped up in anything that anybody's asked them to do, whether it be new routes or picking up seniors. And so there was never a negative attitude towards SMART. It was always, but we need something else. And we always would say, I wonder if we have SMART do that something else if we need it. But anyway, we'll get something together for you. It was a very fruitful conference, and if anybody has any other questions, feel free to call us.
All right, thank you. Any other new business? Commissioner Toko.
Thank you. A couple of meetings ago, the treasurer's office came in and was giving a report, and I asked some questions about the treasurer possibly coming here and doing a report on, or a presentation on, the status of their accepting credit cards. Can we follow up on that, please?
Commissioner Smith.
Thank you. I have talked to them, and they've mentioned that to me, and they have something ready to go. I just don't know if they put it on an agenda yet. But they are ready to answer your questions. Joe said he had a whole presentation on their process for us, so they will be ready for that. I don't know if we have to ask them, but I will take care of it with them to get it on our agenda.
Okay, thank you.
Mm-hmm.
All right, thank you. Any other comments or questions? New business is closed. Number 9, public participation. Anyone in the audience wishing to speak? Seeing and hearing none, the motion is ready for the chair is ready for a motion from Commissioner Drollet to adjourn. Do we have support? By Kraft. All in favor? Thank you very much, ladies and gentlemen.